Hello, and welcome to Blueprint Radio, a guide to fitness, health, and wealth, brought to you by MassMutual Miami, where your financial health is our #1 priority. I am Karen Garcia, here with my lovely co-host, Dr. Scott Shelson.
Hello, hello.
And the always buff celebrity fitness enthusiast, Mr. Tony Thomas.
How you doing? How you doing?
And our #1 goal for this show is to be able to educate, enlighten, and hopefully entertain all of our listeners and viewers on the importance of fitness, health, and wealth to overall success.
Awesome, awesome. Well, today's theme, ladies and gentlemen, is savings. All right, savings. What does that mean in the fitness world? Well, it can mean a lot of things. First of all, when you're thinking about savings, you should see how many times am I utilizing my fitness outsources? Now, many of us get gym memberships and we hardly go, all right? We do not utilize all the benefits that these gyms offer to you. So right there, you should be thinking, what should I do? Should I apply myself and go to every class? Yes, schedule each class throughout your week on a daily basis. That way you utilize your membership better, because if you don't use it, you lose it. All right. Second thing, retention. Do you return to that gym on a day-to-day basis? Okay. Retention is everything. Make sure that that gym is convenient to you. Don't get a membership at a gym that is 200 miles away from where you live. Make sure it's in the path of your everyday life. Going to work, going away from work. A hypothetical. Sarah gets a gym membership and she's doing her thing and she's looking great. She tells you about this gym. For you, it might not be convenient. The gym is in her building. She has to go see it when she wakes up to go to work and when she comes back. So just make sure it's convenient. Third, cost-effective alternatives. One that I'm following is Beat the Gym. Beat the Gym allows the consumer to meet up with trainers in a free public open space and get their workout in, as well as use the site for resources, teaching you different exercises that you can do at home by yourself or at the office or at a park. All right, so you can find out about them at beatthegym.com. Please go check it out. Next week they have a festival, July 11th. Go there, meet the trainers, and maybe you can save on your next fitness expo.
Well, I love Beat the Gym, and as well as Beat the Gym actually takes into consideration nutrition concept, which we're actually working with them as well, and I think that's a huge savings concept, which we're speaking about. And getting right into nutrition, you know, I get a lot of people that come to me and say, it's expensive to eat healthy. Well, so is diabetes, so is your medical bills, and people don't see that until they're actually paying for them or having credit lines messed with, you know?
Right.
So I think that's a huge thing. People always say, I hear this all the time when I speak at different expos. I'm actually speaking with The Biggest Loser next month, and I think one of the things I always hear is I'm a parent of 3 children, and buying organic food is too expensive.
Right.
Well, we're not gonna drop any names, but when people think organic, they think of one place, right? So I think we all get it.
Yeah.
But the idea is that you could buy organic at Costco, you could buy organic at Walmart, you could buy organic at Winn-Dixie, at Publix. Make it convenient, right? So you could shop at one place. You don't have to go to just a farmer's market, which I support, but let's be honest, if you go there and you don't find what you want, are you really saving time? Are you really saving money at that point? So there is alternatives for organic food, and I really recommend organic food because, listen, I'm a big believer that we don't need to put extras that are not the nutrients that we need, right? We need to decrease inflammation. We need to eat what's right for our bodies to begin with. And I think that cost saving and understanding that you can shop for less. I was at Publix the other day, and I put an organic chicken next to a regular chicken, and they had them separate. The organic chicken, same weight, was less money.
Wow.
People don't know that.
Well, it's a branding concept.
Yeah.
But guess what? The reason that organic foods are so highly exposed now is because of demand. So we as consumers need to go out and do our homework. Not just say, well, the world hates me and I can't eat healthy. No, eating healthy is the most important thing in my eyes to life. All right, so you can work out and save, you can eat and save, and as well as with Karen, I think financial saving is a huge thing. So
well, I love it. This topic is near and dear to my heart. The one thing that I think we can all relate to is we've always heard, oh, you should be saving 15% of your income. Oh, you should be saving for college. You should be saving for your wedding. You should be saving for retirement. Well, that's all beautiful, but how do we save? And the truth is, it's very different the way we save, our strategies for saving, whether it's saving for a wedding that's going to happen in 18 months versus saving for our retirement. It's very different to save for college for my 3-year-old son versus my 14-year-old son. So I think the most important thing to think about is how to be strategic with your savings. So some ideas are to begin with timeline in mind. Understand what is short term, what is midterm, and what is long term. So short term being that wedding 18 months down the road, midterm being college, long term being retirement, depending your age. So keep in mind our age. A 21-year-old is going to save very differently possibly than a 54-year-old who possibly has done no savings. So those are some things to keep in mind. Another thing is, again, let's talk about retirement. Well, you're going to save very differently for retirement because you don't need that liquidity as you would, for example, for the wedding or for college or for just emergencies. So you're going to look at different vehicles. Maybe it's a 401k at work. Maybe it's an IRA, a Roth IRA. There's certain instruments that you can look at depending on the timeline, our age, and a lot of other factors. So there's no one answer to each one. You and me, we're all gonna save differently, but the goal is save often, and save first. So that leads to something I'm gonna talk about a little later in my concept, which is pay yourself first. There's really no excuse when we make our cash flow, that cash flow I spoke about 3 weeks ago, you pay yourself first. You put it as a line item. And you know what? If you don't have enough money that month to buy that extra cup of coffee at that brand, name that we know of, then so be it. But I paid myself first.
Can I ask you a question?
Please.
Yeah. Would you say to everybody that it's never too late or never too early to start saving and educating yourself on the concept? Because I think that's the important factor, right?
I would absolutely say it is never too late. Obviously, it's going to be a little more difficult if you walk into, for example, my office and say, okay, I don't have a penny saved, I have a ton of debt, and I'm 54 and I'd like to retire by 60. You've got a lot of work to do, okay? So you better get a really good job. But it's never too late, and it's certainly never too young. Time is always your #1 asset. I mean, I've got my little 3-year-old already structured in his mind, savings is everything. We have a little piggy bank, and he gets used to the fact that if he gets a little birthday gift, it goes straight to the piggy bank. So it's never too early and never too late.
That's the key, make it a habit. Make it a lifestyle habit.
That's
All right, well, these savings segments were brought to you by Genomic, improving your quality of life through personalized testing.
And now we're here with the very special Dr. Alejandro Badia, Chief Medical Officer at OrthoNow Orthopedic Urgent Care Centers. Thank you for joining us.
Welcome.
Thank you.
Thank you.
So like we said, OrthoNow, love the concept, love the rehab center that you just opened up. We actually just came to your event recently. And the ARP therapy, which we'll jump into in a little bit. But you're a orthopedic surgeon, which is huge for us. We love having you on.
Hopefully you don't need me, but
Well, actually last month I could have used you. And you also are very big in the aspect of recovery. I love it, and savings. One thing I want to touch up on, because of my field, let's say, is the pre-surgery, post-surgery, the nutrition aspect and recovery, reducing inflammation. How important do you think that is for your clients to understand diet is important to get to a better state, to recover properly, to reduce inflammation, fibrotic tissues?
well, the whole concept of OrthoNow is really educating the public about orthopedic problems. So that involves everything in the periphery, and obviously nutrition is very important. Particularly when we're doing big surgery. I only do upper limb surgery, so just to clarify that, I do from the fingertip to the shoulder. A lot of what I do is actually shoulder replacements. So that's with a prosthesis, older patients. So nutrition is very important. In fact, our medical director for the surgery center at Doral usually does an interview with the patient some weeks before and actually has them getting them on folic acid and vitamin B and other even antioxidants to really help them in the recovery process. So that's critical for what we do.
Right.
And part of what we do with OrthoNow specifically is educating the end user, which is the injured or patient in pain.
Well, a lot of patients, when they come into a procedure, they feel like they didn't know enough information. It's just kind of forced on them. And I did notice that from the minute we met, that you're all about education.
Yeah, education's critical.
Procedures come after, in a sense, when people feel comfortable.
Yes.
So yeah, recovery is a huge thing. And I think we can all appreciate that.
Absolutely.
Just working with different athletes and going into the preventative medicine type of injuries where you got these guys, you know, they're falling on an outstretched arm, on the hand. What can an athlete expect when they come into your facility for art?
Well, when somebody gets injured, the problem is what to do at that moment, and that's where the big disconnect is. There's a huge redundancy in healthcare in the U.S. If you notice, pretty much everyone thinks they get hurt and they go to either a general urgent care center, which certainly is faster, or the hospital emergency room, which is not fast and expensive. In both of those places, you're not really seeing the right type of doctor. So if an injured athlete, say somebody in one of your workout sessions, comes down and injures their wrist, they would come into an Ortho Now, and within about 10 minutes, they would see somebody who knows what to do for that injury. You're not being referred somewhere else.
Right.
And at that point, that's where the education comes in, Scott, where we educate them about whether it be about the nutrition, about preparation in working out, and then the recovery process, which often is not only formal rehab to some degree, but then incorporating them into a fitness program afterwards. So we get a lot of people that we operate on who maybe didn't do much fitness, and next thing you know, they're joining up with people like you and continuing. So it's actually a really good thing. The problem is awareness, and that's why we have an app, because that way you can go to Ortho Now on your phone. Everybody has a phone now, right?
Right.
So we all have these apps for these things that, let's face it, they're not even that useful. This is an app where, you know, your grandma falls down or your kid gets hurt at school, and you can find out where the nearest Ortho Now is. And you can even tell us you're on your way. We have a trademark, On My Way Now.
Wow.
Yes.
So you put in your name,
Yes.
ankle sprain,
Wow.
They're ready.
So it's prep.
hurt my back.
Prep.
And then when you come in, you know,
They're there,
Mr.
ready to go.
Thomas, we were expecting you. We're waiting for you down in X-ray.
I was actually going to say that a week ago at a JCC tournament.
Yeah.
You know, we had guys that were playing and one got hurt.
Yeah.
And right then and there, we were like, get him some ice, get him, you know, we could have definitely utilized that app.
Yeah.
Maybe had somebody come to the actual facility and see exactly, getting the onset of the injury right away so he can recover faster and get back to playing.
Absolutely, and that's my particular interest in the sports world. That we were speaking before, that I'm a past president of the iSport. The iSport is the International Society for Sport Traumatology of the Hand.
Wow.
It's a mouthful, but basically what it is a group of hand surgeons internationally that have a particular focus of interest in athletic injuries. So I just came back from Rome, where I spoke at the World Tennis Medicine Congress, and I was the only speaker on wrist. Wrist injuries are increasingly a big problem, but the public doesn't realize that, you know, the sports medicine doctors, I mean, they have certain expertises, but not in hand and upper limb. In Ortho Now, we sort that out for people.
And the ARP you had touched on really quickly.
Yeah.
I don't mean to cut anybody off,
Yeah.
but if you could just tell us what ARP is really
Sure,
quickly.
the ARP is for two things. One is the recovery process, or sometimes the initial treatment. So say you come in with painful shoulder. Maybe you've seen me, I've ruled out anything that needs my skill, fortunately, which is with the scalpel. If you don't need that, a lot of times ARP, which is Accelerated Recovery Program, that is a neurotherapy that is I won't say it's new, because it's been used in for elite athletes for 10 years. Some of the big name basketball players here have had it and recover very, very fast. It's in almost every NFL locker room now.
Nice.
So, but the general public doesn't know about it, and Ortho Now is bringing that to the general public.
Fantastic. Well, I want to ask you, we're talking a lot about the athletes, etc. Okay, so a non-athlete like me, right? I go and I'm playing my little, what I call tennis, but whatever, it's just tossing a ball around.
Ping pong.
Ping pong. And I injure myself.
Yeah.
How can I, going back to the overall theme of savings,
Yeah.
how can I save and also be sure that I have the best care by going to an Ortho Now?
Well, you save in two ways. You save by getting to the right person at the right time.
Okay.
So if you go to what virtually everyone does, even friends of mine will call me from a hospital emergency room with me. Now they're going to pay that bill, but at the end they're going to walk out with the problem not resolved.
They're not friends anymore, right?
They're not resolved. Oh, it's very frustrating. Well, I'll tell you an anecdote. So yesterday, one of the guys who works on our team in terms of marketing, his wife falls and fractures her wrist at an ice skating rink in Kendall. So the excuse that they didn't come to Ortho Now was that the urgent care was nearby. I go, well, guess what? She still went to Ortho Now yesterday and walked out with a cast in 45 minutes. Wow. But she still has to pay the bill for the first urgent care.
Yeah.
So that saves money. And it saves money because if you get the right diagnosis at the right time, you will get back to work quicker, which has an economic impact, particularly if you're a business owner.
Yes.
So we've had a lot of frustration in going to big companies, even our county government and the city. I mean, they hear it, but they don't change behavior. Behavior has to be an injured worker, your employee gets hurt. They'll be out of work less. Now you're not paying these per diem folks, you're not retraining somebody else to do their job. It has a huge economic impact.
Well, and if you're saving on bills, you have more money to invest in yourself.
Right.
That's right.
And invest in working out and wine.
That's right.
Better food.
And that's
better
coming
food.
soon.
And putting back toward your savings.
Absolutely. It all works together. But it's important, I think, that people understand that in general, there are, we all have aches and pains and sometimes real injuries. All of those problems Ortho Now can solve for you in a one-stop shopping experience, really.
Thank you so
Yeah, we
much.
really do
I look forward to hopefully having you on again because there's a lot more I want to dig
Yes.
into on this.
Yes.
So
There's
thank
a
you
lot
so
to it.
much, Dr. Badia of
thank
Ortho
you
Now,
so much.
Chief Medical Officer. And this segment with Dr. Badia was brought to you by Work Out Your Wealth, promoting healthier and wealthier living through sound financial and wellness services. Our next guest, I would like to personally introduce as a dear friend of mine for many years, more years than I care to admit, and it is Luis Huicho Hernandez, who is a managing partner at Mass Mutual Miami and the Link Companies. Welcome, Huicho. Thanks for being here.
Thank you guys for inviting me
Thank
on your
you.
set. I appreciate it.
You got it. Well, I want to jump right into the meat and potatoes. If you've been listening, obviously, you know our theme today is savings. So my question for you is two-pronged. Number one, would you like to add anything as my mentor in this world of finances to what I said about savings? And number two, a lot of people don't know this, but one of Mass Mutual's foundational products, if you will, is whole life insurance. How can whole life insurance be incorporated into a savings plan?
Sure. I think for starters, I was listening to Tony earlier, and then hearing your steps towards physical fitness, I was thinking, wow, the parallels between physical fitness and financial fitness are so similar. So many things. It starts with discipline. So when you think of savings, the first thing that comes to mind is discipline. You have to get started. So you can't get better going to the gym unless you start going to the gym. You can't save money unless you start saving. So I think that's the first thing. Most people are waiting to get to that 15%, waiting to say, well, I can't put away 15% yet, so when I could get there, I'll start.
Right.
And what I tell them is, you just got to start. You got to start. You got to take that first step. And for my clients and even our own advisors, I always say, it's like Newton's law of physics. An object at rest will tend to stay at rest, and an object in motion will tend to stay in motion. You got to get that motion going forward. So just like the gym, where you have to go to that gym, you got to get started. I think savings is the same way. You just got to start savings. There's no way to accumulate anything unless you take that first step. So that's the first thing I would add to it.
Action.
I think the second thing is, the discipline of keeping that going. Too many times people will put instant gratification at the expense of long-term vision, long-term goals. So instead of, you mentioned the branding, instead of spending $4 or $5 for a cup of coffee, maybe giving that up once a day, instead of having 2 or 3 of those a day, have 1, have 2, and then put that money away. And then of course, as you mentioned, the time told the strategy of, you got to pay yourself first. If you mentioned, if you have a gym membership, either you use it or lose it. For money, it's the opposite, right? If you use it, you've lost it. So put that money away first. And it's amazing when you pay yourself first, the psychological advantage of just that money's gone now. You don't have it, so you don't spend it. When you do everything you want to do, you always have something you need to do, whether it's the kitchen, whether it's the bedrooms, whether it's I want to buy this month. Where if you pay that and you put it into your savings account first, it doesn't happen. You make it work with what you have in place. So those are the things that I probably have the consumers focus on, but don't try to get to that magic number 15. Just take that first step, and there's no number too small to get started with savings. There's plenty of programs out there for people to just start saving, and much like the gym, Tony, where when you start going to the gym, it's infectious, right? It's hard to get started, right? But then you start seeing results a little bit, and you look at yourself in the mirror more, and you start feeling good about yourself. Savings is the same way.
Yeah.
If you have a zero balance, it's tough. You don't want to look at it. But all of a sudden your balance is going up, and now you have a few $1,000, and then that starts going, and then also you're talking more about savings. It becomes infectious, much like going to the gym.
Fantastic. Well, thank you. And I don't want to forget, I'm sorry, I don't mean to kind of come back, but I did want to mention whole life insurance. The only reason I mention it is it's a specific product, but it's not something a lot of people are familiar with. So I just wondered if you could mention a little something on that.
Sure, and I'll try to keep it short.
Yeah.
Whole life insurance is probably one of the most versatile products that are out there. Now, it's not the best thing for everybody, but it seems to be good at a lot of different things, whether it's tax advantages, whether it's savings, whether it's protection. It gives you a lot of opportunities as a person. What I would tell people is, whether it's good for you or not for you, financial planning or looking at your future should be individualized. If someone says, well, the rule of thumb is this, to me that's a red flag already. Forget the rule of thumb. What is financials to you? So if you're looking at whole life insurance, make your own judgment, your own opinion on
Got
it
it.
versus listening to other experts.
Thank you. Thank you.
As a UM athlete and a professional athlete,
I'll have to say that again.
Okay. We had to do
Thank
it.
you.
and now a professional, can you go over some of the parallels?
Well, I talk about this a lot when I'm invited to speak at different places, and the training that I got playing for the University of Miami and playing professional ball helped me more in business than many of the business courses I took, and it helped me because of the discipline. Much like we talk about discipline in savings and discipline in working out, as a business person, the discipline I learned as an 18-year-old under Coach Ron Frazier and then later on Coach Morris has been such a huge advantage for me now as a business person. So I think that's the biggest parallel that you would draw. And the second thing is learning how to work with other people. When you play team sports, you depend on other people. There's no way to succeed unless you're all working for something in common. And I think now as a business that has over 150 employees, it's very difficult to succeed unless everyone's on board with a clear vision, a clear passion. But those would be the two things I would draw together.
Fantastic.
Awesome.
Really do appreciate your
Well,
time.
thank you so much for your time. Winter Hernandez, Mass Mutual Miami.
I learned so much.
Yeah.
I know, because we did.
Absorbing it all.
Thank you so much.
Thank you guys, appreciate it.
Now it's time for our takeaway section, and I'll start off with Doctor's Lowdown. I want to just tell everybody to check the labels. I know you hear it all the time, but a lot of times we see fat-free, sugar-free. A lot of times they're putting a lot more carbohydrates in there. So check it so you know exactly what you're taking in.
Awesome, awesome. And Tony's takeaway today is the age-old question. Do I do my cardio before I do my strength conditioning, or do I do strength conditioning before cardio? The answer is, it depends on what you want. If you're trying to build, make sure you get your strength and conditioning in first so you can maximize on all the energy you have and your output in your weights, and then do the cardio after. If you're just trying to maintain, burn, and protect that endurance phase, then do your cardio first.
Fantastic. And now it's time for Karen's Concepts, which is very simple if you've been listening to the show. Pay yourself first. And here's a quick tip on how you can do that. Enter it as a line item in your budget. Set it up as a bill pay on your bank account. Call it Paying Myself First, and pay that bill every month at the beginning of the month. And that was our takeaway section. We want to thank once again Dr. Badia of Ortho Now and Huicho Hernandez of Mass Mutual Miami and Link Companies.
And now we have a little wine tasting.
Oh, that's right.
Tell us what this is.
That's our Cupani Falanghina, which is a white wine, 100% organic from the southern part of Italy.
Tamarina with organic. This is what I'm talking about.
Coming through. Thank you so much.
So we want to do again thank Tamarina.
That's right.
I wanted to let everyone know. Follow us on BlueprintRadioShow.com. You can find all of our videos, all of our links, our sponsorship, which are very important. And thank you to Tamarina again, Amp Squared, Intuit Media Group, Genobic, Work Out Your Wealth, and Matthew Zakowski, attorney at law. Because again, everybody needs one. And Mass Mutual Miami, we love you. Cheers.
Cheers.
And don't forget,
My tips.
And the wine's getting to him.
he will have no shirt on.
That's right. Tony shirtless. Stick around.
Stick around. Cheers to that.
Hi and welcome to Tony's Tips. Today I got executive/doctor, Dr. Badia here with me. We're gonna show you some simple exercises that you can do in your office, all right, and still work on getting that waistline slimmer. Okay, we're gonna get down into a plank. All right, this is your traditional plank. This exercise is gonna take about 90 seconds. We're gonna do 30 seconds, a traditional plank. So we're gonna start here. This is how we do. Time lapse, we're holding it. We're holding, keeping our abs engaged. Hips are flexed, digging into the ground, keeping your back parallel the whole way through. All right, so after this 30 seconds, we're then gonna start doing a hip swivel, working our obliques, left to right. So start going left to right. We want to engage, driving that elbow into the ground, working those hips left to right. We're going to do this for 30 seconds, all right? You still want to maintain that flat back on the top part of the movement, but at the same time, we're not losing our abdominal engagement. We're keeping that muscle firing the whole time through. And then lastly, for the last 30 seconds, we're gonna get ballistic, all right? We're gonna open and close, working those abs, getting up and down, all right? We're gonna do this for 30 seconds, incorporating nothing but our hip flexors, our abs, and keeping our core tight all the way through. Got about 10 more seconds.
Seems like
You say,
10 minutes.
Doc? Yeah? Now this is a quick and simple exercise that you can do at the home, at the office. And Dr. Padilla, thanks for being the amazing client that you are. And that's Tony's tips for today.